Now, every politician knows the National Health Service is a sacred cow when it comes to talk of the need for cuts in public spending. If politics is about choices, it is one choice no one wants to argue for. But if there's a surge in demand for healthcare because of growing population, what does it mean to say the budget is ring-fenced? Not much, according to the Institute for Fiscal Studies, which warned today that by the end of this decade, we'll have gone through a cut in health spending per person of 9.1%. Andy Verity reports.
Who wants to think about money when this is happening?
Oh my God. It's humbling, knowing you're carrying life within you, and millions and billions of other women have done the same thing.
It's knowing how fundamental wishes like that are, from giving birth to staying alive into old age, that led politicians to ring-fence the NHS budget. But with each of those wishes fulfilled, there's a new human being with needs, and they'll need healthcare for longer than ever before. From the roof of the Royal London Hospital, where Bookie's having a scan, you can get an idea of just how many extra people trusts like these now have to serve. It's because of the surging population, not budget cuts, that NHS budgets are getting squeezed. The population growth's down to two factors: immigration and people living longer. And that means that even though budgets are ring-fenced, they're spread across more people, and therefore there's less money to spend per person. Today, the Institute for Fiscal Studies made it clear how flimsy a defence the NHS ring-fence has become. Between 2010 and 2019, the population will have grown by 3.5 million.
We're in this really tough position where NHS spending is being protected, which is meaning that everywhere else is having to see big cuts, but actually even the NHS is going to feel really tight. And the actual effect is there's about 9% less to spend on each individual, given what's happened to the structure of the population.
The country's biggest trust, Barts Health, says it's already shown you can find ways to care for more patients with the same budget by avoiding waste, like missed appointments.
Missing appointments cost money, so instead of women going to 3 different appointments at 3 different sites, they come in here and they have all of the 3 appointments in the same day. So on the same day we do the bloods, we do the booking history, and we do the scan.
In another example of cuts that can help patients, London's stroke wards were cut. That caused howls of protest, but helped patients avoid the most expensive part of healthcare.
Now you get taken, if you have a stroke, to one of 8 hyperacute stroke centres in London, and we're sitting in one of those here at the Royal London Hospital right now. And what's happened there is that the length of stay across London for stroke has gone down from an average of about 19 days to about 10 days. That's a significant benefit to patients and a significant saving for the healthcare economy.
If you do well enough keeping people out of hospital, it becomes logical to cut back on hospital beds.
The problem is this isn't a national hospital service, it's a national health service, and we tend to focus on hospitals as if they are the only way that care can be delivered. And one of the problems is that we find it difficult to demonstrate to the public and to some politicians the benefits of delivering care closer to home, more personalised and involving and engaging patients and carers.
But as the Health Secretary Jeremy Hunt found recently when he proposed downgrading accident and emergency services at Lewisham in London, what's clinically logical may not be politically palatable.
Lewisham United will never be defeated.
Efficiencies can mean innovation, but it can also mean subtly restricting access to some treatments, otherwise known as rationing.
At what point do you actually need an operation? What's the sort of threshold you have to cross over before you really need a cataract? How ill do you have to be before you have a hip operation and so on? These are sort of clinical judgments, and they are judgments. There's not a fixed line in the sand, but the NHS has looked at those. In a sense, how blind do you have to be before you have a cataract?
However the NHS innovates, it will be hard to convince the public that a cut of 9% per person won't hurt a bit. For couples making their own contribution to an increased population, every pound spent on healthcare is precious.